everyone, and today we'll start with the very interesting as well as very important topic, which is facial nerve. And for sure this topic come under university exam in 5-mark note. And under facial nerve we'll cover its nuclei, its course and relation, its branches, and we'll see that how and from where this nerve get originate and how many branches it give, which structure it supply. So the facial nerve is the nerve of second brachial arch. Right now I can explain you that what is brachial arch. Only in brief that these are the prominent or series of bulges that present on the lateral surface of the developing head of the embryo. And later on these arches give rise to many structures like cartilage, gland, bone, nerves, etc. And all the structures are who are the derivative of the second brachial arches are supplied by the facial nerve. So that is why this nerve is known as a nerve of the second brachial arches. Next is its nuclei. So facial nerve carries a 4 nuclei, and all the 4 nuclei are located in the lower region of the pons, as you can see over here. Start with the motor nucleus or brachiomotor, and then superior salivatory nucleus or parasympathetic. It means it carries a parasympathetic fibers. Next is lacrimatory nucleus, is also parasympathetic in nature, and nucleus of tractus solitarius. And the facial nerve is a mixed nerve because it carries motor, sensory and parasympathetic fibers. Now we'll see the location of the nuclei. As you can see, all the nuclei are located on the lower portion of the pons. This is a facial nucleus, this is a lacrimatory nucleus, these are the salivatory nucleus, this is a superior salivatory, this is an inferior salivatory nucleus, this is a nucleus of tractus solitarius. Now, the first one is a facial nucleus or a motor nucleus which carries a motor fibers and supply to a facial muscles of the face. Next is a superior salivatory nucleus which carries the parasympathetic fibers and supply to submandible and sublingual gland. Next is lacrimatory nucleus, which is also parasympathetic in nature. Through a lingual nerve or a deep petrosal nerve, it supplies to lacrimal, nasal and palatal gland. But over here, chorda tympani, we'll see that chorda tympani directly gave its supply to submandibular gland, but with the lingual nerve, it gives its fiber to sublingual gland. Next is nucleus of tractus solitarius, which is sensory in nature, and it carries its sensation from the 2/3 of the interior tongue plus from the taste bud. Now we'll study its course. Now we'll study its course and relation. The facial nerve are attached to the lateral part of the lower border of the pons. As you can see, this is a pons, this is a medulla. These both are the lateral part, this is a medial part, center is a medial part, these both are the lateral part, and the same structure is present on the both the side. So this is in between is a 7th nerve, carries a thicker one is a motor root and thinner is a sensory root, and this is a 8th nerve, this is a 6th nerve. As you can see, 6th, 7th nerve is present just medial to the 8th cranial nerve by 2 roots, which is a motor and sensory known as a nervus intermedius. So this is a 8th nerve, and 7th nerve is present medial to the 8th nerve. Now we'll study that. So this 7th nerve does not directly descend downward. So we'll study over here that 7th nerve goes backward, pass around the 6th nerve and then descend downward. When it is passing around the 6th nerve, it gives its elevation, which is known as a facial calculus, and this bend is also known as an internal geniculate. I can explain you one more time that this 7th nerve does not descend directly downward. Instead, it goes backward past the 6th nerve, which is known as abducens nerve, and then it descends downward. And while passing this sixth nerve, it gives its elevation, which is known as a facial calculus, and this bend is known as an internal geniculate. Now you can see the two roots run laterally and forward with the eighth nerve, which is a vestibulocochlear nerve, and reaches the internal acoustic meatus. As you can see, both the roots of the seventh nerve with eighth nerve enter this internal acoustic meatus. And how these motor root and sensory root with the eighth nerve located in this region, we can study over here. In the meatus, the motor root lies in a groove on the eighth nerve with sensory root intervening, accompanied by a labyrinthine vessel. As you can see in the internal acoustic meatus, this one is the eighth nerve, this is upper is motor root of seventh nerve, and intervening is a sensory root of seventh nerve. These are the labyrinthine vessels. So when this seventh root accompanied by eighth nerve, seventh roots like sensory and motor root accompanied by eighth nerve enter into this internal acoustic meatus, these nerves lie in this position in internal acoustic meatus. And at the bottom or fundus of meatus, motor as well as sensory root fuse to form a single trunk lies in petrous temporal bone. So after it exits this internal acoustic meatus, the motor root as well as the sensory root, they both fuse to form a single trunk, and these approaches the middle ear. But first of all, I want to explain you that from the internal acoustic meatus, this middle ear, this whole structure is present in petrous temporal bone, or the temporal portion of the skull. So now we can explain over here. When it approaches to this middle ear, it enters into the medial wall of the ear with the sharp bend, which is also known as a geniculate ganglion. Upper is known as internal geniculate. This is known as a external geniculate, and it enters into the medial portion of the medial wall of the middle ear. Before it enter into this middle ear, it give its branch, which is known as a greater petrosal nerve. And this greater petrosal nerve enter into this nerve to pterygoid canal. There is one more thing, this deep petrosal nerve, which is surrounding or around this internal carotid artery, is also accompanying this greater petrosal nerve in the pterygoid canal. And this both deep petrosal nerve as well as greater petrosal nerve in a pterygoid canal is known as a Widion's nerve. Later on, as we know that greater petrosal nerve is a parasympathetic in nature, it relay its fiber in the sphenopalatine ganglion, and this is a preganglionic fiber, these are the postganglionic fiber, and in postganglionic fiber it gives a lacrimal nerve, whereas a deep petrosal is a sympathetic nerve, so it does not relay its fiber, it directly supply these. So with the lacrimal nerve as well as the deep petrosal nerve, these both nerves supply to the lacrimal gland, nasal gland, palatal gland, and pharyngeal gland. Now we can see, before entering into this middle ear, this nerve gave its branch, which is known as the greater petrosal nerve, but it approaches the medial wall of the middle ear. As you can see, this is a roof, this is a floor, this is the interior wall, this is a posterior wall, and this is a medial wall. So this motor root plus sensory root, these both root fuses to approaches the medial portion, medial wall of the middle ear, and then it goes towards the posterior wall, and in posterior wall it descends vertically downward, but in posterior wall it gives its branch to this pedius muscle. So nerve to this pedius muscle, one is nerve to the coda tympani. Nerve to the coda tympani It is also parasympathetic in nature, and it's also relay its fiber into this is known as a submandibular ganglion. In this case, the fiber directly supply to the submandibular gland without any nerve. So coda tympani, this is a preganglionic fiber. It relays fiber into the submandibular ganglion, and it directly through its fiber supply the submandibular gland without any nerve. As you can see over here, that greater petrosal nerve relay its fiber into this ganglionic preganglionic fiber into this spinopalatine ganglion, and post-ganglionic fiber are carried by lacrimal nerve. But here there is no such case. Here the coda tympani nerve carry its fiber and directly it giving its fibers to the submandibular gland, whereas in sublingual gland, this lingual nerve, it accompanied by this and then it supply this sublingual gland. Next is, after this posterior wall, it descend downward and exit through the stylomastoid foramen or exit the skull. And as soon as it exit the skull, it give its supply to the posterior auricular as well as a posterior belly of digastric muscle and stylohyoid. And then it enter into this parotid gland and gives a 5 branches. First is temporal branch, next is zygomatic branch, then is buccal branch, then marginal mandibular branch and cervical branch. Now one more time I want to explain you that, as you can see over here, the facial nerve, which is the 7th nerve, is located in this bone region, or on the lateral side or the lower border of the bones. This is the lateral side or the lower border of the bones. This is the 7th nerve. And there is a motor root, which is a thicker, and sensory root, which is a thinner root. And this is the 8th nerve, and the 7th nerve is present medial to this 8th nerve. So the 7th as well as 8th nerve enter into this internal caustic matrix. And how? The 7th root nerve does not directly descend downward. Instead, it goes backward, passes the 6th nerve, give its elevation known as facial caliculus, and this bend is known as internal geniculate. After it descends downward with the 8th nerve, which is a vestibulocochlear nerve, it enter into this internal caustic matrix. And how both the nerves are located in internal caustic matrix, you can see over here. This is the 8th nerve, this is the 7th motor root of 7th nerve, this is the sensory root of 7th nerve, which is intervening these both. This is a labyrinthine. So as it exits this internal caustic matrix, the motor root as well as sensory root fuses to form a single trunk and approaches the middle ear. And these both structures are located into the petrous temporal bone or the temporal portion of the skull. As we know, the ear is located into the temporal portion of the skull. So it approaches the middle ear. Before it enter into this middle ear or the medial wall of the middle ear, it give its branch, which is known as a greater petrosal branch. And this greater petrosal branch enter into the nerve to pterygoid canal with the deep petrosal nerve, which is sympathetic in nature, and greater petrosal is a parasympathetic in nature. So it relay its fiber into this sphenopalatine ganglion, and this post-ganglionic fiber are carried by this lacrimal nerve. As we know, this is a sympathetic in nature, so it does not relay. So lacrimal nerve plus petrosal nerve, both these nerve supply this lacrimal gland, nasal gland, palatine gland and pharyngeal gland. But afterwards, when it enter into the middle ear or the medial wall of the middle ear, it gave a sharp bend, which is known as a geniculate ganglion. Afterwards, it descend towards the posterior wall and descend vertically downward, but it gave nerve to stapedius muscle, and one is coda tympani. This nerve is a coda tympani, which is also parasympathetic in nature, and this this parasympathetic preganglionic fiber relay its fiber into the submandibular ganglion. But there is a without any nerve, directly its fiber supply the submandibular ganglion. But here with the help of this lingual nerve, this sublingual gland is supplied. So as soon as it exits the stylomastoid foramen, or it exits the skull, it gives its supply to the posterior auricular muscle or posterior belly of the digastric or stylohyoid muscle. And then it enter, or facial nerve enter into this parotid gland, or give its supply to the temporal or the facial muscles, which are the temporal, zygomatic, buccal, marginal mandibular or cervical branch. Next, we'll see its branches and distribution. Within this facial canal, it gives greater petrosal nerve to speedius muscle, chorda tympani. Like as you can see over here, one is greater petrosal nerve to speedius, and this is a chorda tympani, which is parasympathetic in nature. It is also parasympathetic in nature, and it gives its supply to speedius muscles. And exit from the stylomastoid foramen, like muscle to posterior auricular, posterior belly of digastric and stylohyoid. And terminal branches with parotid gland, it's supplied to temporal, zygomatic, buccal, marginal mandibular and cervical. I hope this topic get clear to you, and so thank you very much.